what about men? Because the profession over the last several decades has become heavily feminized, which I don't know is like a problem in and of itself, but I feel like there's a lot of men's issues that are getting left behind, and kind of a general understanding of masculinity is less than it needs to be in the field. You see that?
Yeah, I think my central. I think there's just kind of a broad misattunement in the way the field is branded and presented to men. What I would say to men around mental health issues is that social emotional skill is going to be absolutely essential to anything you want to do in the modern world. You can't be a leader in anything without very strong social emotional skills. You need them to be a CEO, you need them to start a business, you need them to do whatever you want to do. Social emotional skill is pretty important. And so part of that is being aware of what you feel and why, and what other people feel and why, and how those interpersonal patterns are reproducing, so that you can understand them and speak candidly and directly about them when needed, and you can assertively and constructively respond to problems. These are absolutely essential things to being a man. And it's going to be helpful for dating, helpful for relationships, helpful for being a dad. Everything that you do, you need high social emotional intelligence. So it's not like come into therapy and talk about your feelings and cry about it and be a victim and feel vulnerable or something. I think that's the way that a lot of men fantasize and rightfully so. I think there are people that practice that way, and it's cringe, and it's, I wouldn't encourage it, but it's like, it does happen. But it's like, the reality is a lot of men have, like, you have to be able to be aware of what you feel. I think engage it. Your emotions are also fuel. Their motivation. If it's anxiety, can be fuel. Anger can be fuel. Anger usually is there's a problem that you need to speak up and respond to. You don't need to go out and hurt somebody or do something destructive, but sometimes you're frustrated because there's something you need to speak up about. And that could be a constructive, positive thing, that you're addressing a problem. Anxiety, similarly. Sometimes you're anxious because you need to get something done. So use that, So I think, like, it's good to be connected to them. They can strengthen relationships and enrich life and lead to creativity and all kinds of positive stuff. So some type of emotional engagement is good, and it doesn't have to be like, well, how did that make you feel? And are you sad now? Stuff that's like doesn't need to look that way. And so I think that if therapy was reframed, it could resonate with men better, and make them more willing to engage treatment and get more out of it, because they know what they're doing a little bit. But it's not the way that it's often kind of branded and presented. I think it strikes a lot of men as cringe. It strikes me as cringe a lot of times too. And I think that's probably the central bias. I think there's all kind of other biases against men that we could get into, but that's probably the most important.